Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 556. What is acute respiratory distress syndrome? Acute respiratory distress syndrome is a life-threatening lung condition that prevents enough oxygen from getting to the lungs and into the bloodstream. What are all the causes of alveolar capillary permeability? Philic substance is going to cause damage.
For a better understanding, best USMLEFasttrack.com.
This is Andrew Wolf, and I am going to make a short video about acute respiratory distress syndrome, otherwise known as ARD, around the nexus between if the person was in a fire and breathed in, and the tissues are and all these inflammation. So the lungs are sort of the first, and the capillaries, or whether it's endothelial cells, are going to fluids leaking out, so we end up with injury to the cells. It's going to fibrin deposition and permanent match, and the decreased compliance.
Ensure that the equipment is prepared and check that the laryngoscope is working and the cuff on the tube inflates and deflates properly. Pre-oxygenate the patient with bag and mask ventilation for up to 1 minute before attempting to intubate. Standing behind the patient with the head in the sniffing the morning air position, with the left hand, insert the curved blade of the laryngoscope into the mouth over the right side of the tongue, displacing it to the left and upwards. Advance the laryngoscope slightly until the tip of the epiglottis can be seen posterior to the back of the tongue. Advance the tip directly between the cords, 15 mL of air, to prevent air leaking during the position of the tube by auscultating the bag and mask ventilate the right main bronchi, wet to the ventilating apparatus, and ventilate the patient.
C-reactive protein is an annular, pentameric protein found in the blood plasma, the levels of which rise in response to inflammation. Its physiological role is to bind to phosphatidylcholine expressed on the surface. It was initially thought that CRP, promoting CRP inhibition can be a safe medicine.